On your Health Watch, this week is National Women's Health Awareness Week. All week we're focusing on topics important to keeping you in your best health. Today we're looking at an issue many women live with but are too embarrassed to talk about, and that is incontinence. Joining us live in our studio is nurse practitioner Susan Wyndham from the West Alabama Urology Associates, and this is a topic that touches so many women's lives, and there is a stigma attached to it. But I think it would be comforting for a lot of women to know that they're not alone. It's very prevalent.
No, the American Urologic Association estimates that over 15 million men and women suffer from incontinence. The majority of those people probably would be women. A lot of women think it's the normal aging process, but it's really not. Incontinence is never a normal finding. And what we want women to know is that there's lots of treatment options now for all the different types of incontinence that are out there.
Well, and you mentioned different types, so it's not just one type. Talk a little bit about the types.
There are generally what's considered 4 different types of incontinence. The first is what's known as stress incontinence, or when you leak urine if you go running, cough, sneeze, or even laugh. The second type is called urge incontinence, and we jokingly call that key in the door incontinence, when you put the key in the door and you haven't been to the bathroom all day long and you've got to go. But it's that strong urge to go to the bathroom and not getting there in time. The third type is called mixed incontinence, where you have both stress and urge. And the fourth type is called overflow incontinence, when for whatever reason the bladder doesn't empty well and the leakage is persistent, kind of like water over the dam.
And the good news is there are treatments for these conditions.
There are treatments. There are medications that work very well for different types of incontinence. For stress incontinence, there are surgical interventions and treatments that work. One of the things that's very new on the market is Botox, which sounds kind of funny.
Fascinating, yeah.
But it's used for different types of incontinence. It's FDA approved. And our surgeons have done several cases, and we've been very pleased with the progress. The patients have been ecstatic.
Wow. Well, yeah, and this is just, touching the tip of the iceberg, because this is such a big topic. And we're going to give your contact information at West Alabama Urology Associates, and here's the number. It's 205-344-9393, and you can also get a link to your website on our website, WVUATV.com. Susan, thank you for being with us for a topic that's so important to so many women out there.